My name is Redae Redae. I am a consultant endoscopic surgeon working here at King Faisal. The gastric balloon placement is a well-known established procedure we used for weight management, weight reduction for some obese patients. We put this balloon inside the stomach using endoscopy. It's a very simple procedure. It needs the balloon itself to be available in the market and the expertise to do it. And the third one is the patient who is willing, or the people who are willing to put the balloon in the stomach. So for this simple procedure, people were traveling to Kenya, Turkey, other countries. So now all the three things are here in Kigali, in Rwanda, so we can do it easily. It's a 15 minutes procedure, easily, with not much side effects. What the balloon does, it occupies a space, and that occupying space creates a false sensation of fullness, as if the patient eats some food and he doesn't want to eat. So that makes the patient forced to eat small portion. So that small portion, there is barrier to eat more. So he cannot eat more unless he forces himself. Otherwise, that sensation of fullness will limit him to eat the usual portion. So he eats a small, reduced portion of meals per day, then gradually it will lead to the weight loss. Usually, weight management there are a lot of methods to lose weight. Diet, physical exercise, medication, endoscopy procedures, and surgery. So based on when someone wants to lose weight, we always advise them to start with diet and exercise. But there are some people, because of different things, they cannot achieve what they want just by diet. And so what's the next option? Nowadays there are medications which helps people to lose weight, as those medication has serious side effects. So you have to decide to try it or not, and you can also try and stop. We do endoscopy when then there are wires we put in the stomach. We call them guide wire. Under that guide wire, we put the balloon with the inflator into the stomach, and we fill the balloon with water. The water, it's between around 600 and 700 milliliter water, depending on the expected weight loss. We put it, we fill it, then we leave it there, we come out. The procedure usually takes around 15-20 minutes, the procedure itself. But as I told you before, the patient will go through anesthesia, we give him medication, he will sleep, then we do the procedure, then he has recovery time around 30 minutes. In total, in 1 hour, he will be ready and can go home the same day. There is no pain from the balloon, but endoscopy is not a pleasant procedure. So not to be irritated by the endoscopy, we make them sleep, and they didn't know what happened to them. They sleep deeply, and when we finish the procedure, they wake up as if they sleep and wake up. Patients who obesity, there is index, BMI index, not more than 40. Why it is important? Because if it is more than that, you need another supplementary or surgery or other methods of weight loss to be added or considered to achieve the intended goal. So to have maximum effect from the balloon, if you are in that range of below 40 BMI, you will have those promised around 15% of your body weight loss in 6 months' time. Balloon is there for more than several years in the market, and it's well studied. And the average weight reduction is around 15%. So if you follow the diet plan and it depends also the person's discipline, the average weight loss is 15%. That means most of the people weight around 15%. Some of the people are above 15%, some are below 15%. One of the main thing of the gastric balloon, the advantage is it is reversible. You can remove it. Even if when you do a surgery, a sleeve gastrectomy or other we call it bariatric surgeries, if the patient doesn't follow the strict discipline, the strict instruction of the physicians, the surgeons, even a resected stomach can recover. Even those patients who are a resected stomach, they can gain the weight they lose if they are not disciplined. On this case, even in gastric balloon, after removal, if the patient is not disciplined, he can gain those weights he loses during the 6 months and more. The main thing and the advantage of the balloon is why 6 months. In 6 months' time, we believe that the lifestyle change he makes will be permanent. We give up after post-procedure diet plan the patient should follow, and he will have a follow-up visits to our clinic on the 3rd day, 7th day, 10th day, 3 months, and at 6 months we evacuate the balloon. During this period, he has to be disciplined. If he do physical exercise, it's additional gain. We have to also follow some diet restriction, but as I told you, the balloon itself causes a portion restriction. As any medical procedure, there is a potential risk. But from what the panorama of weight management methods, it's one of the safest, because if you feel uncomfortable, if you have some issues with the balloon, or after sometimes you want to try something else, you can just remove it, because there is no any permanent alteration of the GI tract. So you just deflate the balloon and remove it, and the patient goes to his normal way of life. As any medical procedures, there may be some issues. For example, it can burst. To burst it, the balloon, it's very hard. It's a very proved silicone product. It will not burst easily. But if there is a defect on the manufacturing side, if the water leaks, you cannot get the image. You will have some dyspepsia and some obstruction signs, which may happen. But the chance of getting those complications is very, very rare. And this, as I told you, people also can refer. Now it's a digital world. They can refer, read about it, and make a decision based on the information. the insurance companies, not only here in Rwanda, but in other countries also, the weight management and the weight reduction therapies are a bit tricky. They may think that it's a cosmetic procedure, but it is a disease, a well-established. Obesity is a well-established disease, and treating obesity, it also prevents other medical conditions like kidney problem, heart problem, joint problem, diabetes, hypertension, whatever you call it. If you think with that perspective, the insurance should cover this kind of procedures to prevent those diseases before do permanent damage and the patient stays on the insurance back for the rest of his life. But I don't think so that here in Rwanda it will be the procedure, the whole procedure will be covered by insurance. But for now, the balloon, the patient goes to the pharmacy and purchase the balloon from his pocket. The procedure we do is the endoscopy. It's covered by the insurance. Not only in Rwanda, but generally in Africa, we are now, because of the urbanization, the diet pattern, the lifestyle, people are getting more heavy, and with that there are a lot of medical conditions coming and affecting people socially, economically. So one of the ways to prevent this is to manage the weight, to fight obesity. As I told you, gastric balloon is just one of the simple methods to fight. There are a lot of methods. The combination of these methods, it will lead to the reduction of occurring those chronic conditions which affect especially obese patients. It will have a positive impact. Usually, always when you start new things, it becomes very expensive. Here, as I told you, we didn't add anything new on the cost. The new cost is they purchase the balloon from the pocket. My advice to those people who are considering this procedure, the first thing is they have to come to the clinic, to the hospital, sit and discuss with the physicians and discuss their need, what they were trying, or what is their medical issues, health issues. Then with the physicians, with the doctors, they can select which one is convenient, more effective for their health condition. And if it is a gastric balloon, it's available there, it can be done here, we can go with that. The first thing is, who is considering to lose weight, this method or that method, he should come do the physical and the normal checkup, which shows that the current status of the health condition of the patient. Based on that finding, we'll decide which way to go.